In the last study that we presented at this year tandem meeting, we presented the data of a large cohort of a patient affected by lymphoma who received an allogeneic bone marrow transplantation using a haploidentical donor or a matched unrelated donor. In both cohorts, our patient received a post-transplant cyclophosphamide-based GvHD prophylaxis. So in this case, our primary hypothesis was that when using a post-transplant cyclophosphamide GvHD prophylaxis, it is not important if we are using an haploidentical donor or a matched unrelated donor, because they will have the same survival results. So to do that, we work in collaboration with the CIBMTR and the EBMT Association, and we collected more than 2,000 patients. The Haplo and the matched and unrelated donor group, and we perform a classical analysis in this regard. Finally, in our preliminary results, it was clear that a matched unrelated donor had a superior overall survival, which was our primary endpoint of the study, in compared to the haploidentical transplantation cohort. Also, the matched unrelated donor cohort was characterized by a higher, statistically significant higher progression-free survival, and also a higher, a better non-relapse mortality, which was in favor of the matched unrelated donor group, but not by a more favorable relapse of disease. So possibly this survival difference was explained by a higher non-relapse mortality in the haploidentical group. Finally, we also found as a secondary endpoint that the matched unrelated donor group had an inferior incidence of both acute and chronic GvHD. Of course, this study is a retrospective study, despite the large number of patients that we could collect, just because we use both registry, the CIBMTR and the EBMT study. It has several biases which are related especially to differences, sometimes significant differences between the two cohorts of patients. So in order to address this issue, we perform two sensitivity analyses based on a propensity score, which was trying to address especially the differences which were present in related to the donor age of both groups. In fact, in our study, the haploidentical donor cohort of donors were generally older than the matched unrelated donor group. So to do that in the final analysis that was finally presented at the tandem BNT meeting of this year, we confirmed the results that we had presented in the previous analysis at ASH 2021, presenting also the sensitivity analysis results. Of course, these results should be confirmed in a prospective and hopefully a randomized prospective study, but we do know that it is difficult to conduct such studies when you have to select between a matched unrelated and a haploidentical donor.